It's time for the Source to do our weekly check-in with Derek McNally, the Executive Vice President of Clinical Services, also the Chief Nursing Executive for Niagara Health. Derek, welcome to the program. Some big changes, I guess, at the hospital. You have a new mask policy at all Niagara Health sites.
Good morning, Mike. Thanks for having me back. And yes, we do. Just a couple of days ago, we started a new masking policy, so we're taking further precautions. So all patients coming into our emergency departments and urgent care centres, as well as our outpatients and visitors, are now required to wear a mask at all times. So that's the new policy. So while they're wearing their masks in the hospital, it includes all public areas, elevators, etc. Patients and visitors can actually bring their own mask if they would prefer, but if they come without one, then we'll obviously supply them a mask. If someone does wear their own mask and they come in and it's wet or damaged or whatever, then we'll ask them to dispose of that and we will give them a new mask. And of course, as always, we're always encouraging the community to wash your hands, social distance, same story every week, but just so very important, Mike.
Logistically, I'm most familiar with the St. Catharines Hospital site. So when you walk in that front door, are they expected to check in at that volunteer table?
Yeah, so everybody that comes to any of our sites, we have separate entrances for our staff and physicians. Our main entrances at all 5 sites have staff at those front entrances screening every patient, visitor, that comes in. So they are screened. They're asked the regular questions that we would normally ask to screen for COVID-19, and at that point they will be handed a mask.
Has there been any loosening of restrictions with the visitors policy that was put into place under COVID-19?
Mike, not at this point. We're still pretty strict, if you will, about visitors coming into the hospital. But we have had a number of visitors come in for the areas of concern that we previously discussed. So patients who are palliative, patients who are end of life, pediatric patients, mothers in labor, bringing someone in with them. So those are the same visitor policies and restrictions that we've had from the beginning.
Elective surgeries, or I shouldn't say elective surgeries, but non-emergency surgeries have now been allowed. So what is the planning for resuming those kinds of surgeries?
We got the go-ahead, as you know, last week to resume scheduled surgery and procedural care this past Tuesday. As you know, and I've reported before, we have continued to do cancer surgeries, emergency surgeries, urgent surgeries. So, for example, vascular surgeries. What we're currently doing in Niagara Health is looking at all of our surgical cases. Over 2,700 cases were postponed, so we have to catch up with those. But we're also looking at a recovery plan for the whole organization. So as we start to open up, we have to do that in a very thoughtful way. And there's a number of considerations that we have to have. So we have to make sure that we have a stable supply of PPE that will be able to use for surgery, but also if we get another wave of COVID, then we would have to ramp down surgery, ramp up what we did before for closing down for COVID. We've been told by the province that we should really have an 85% occupancy rate, and then that in turn then would give us the ability to quickly ramp down and ramp up without using unconventional spaces, without crowding our emergency rooms again, and all of those things. And then obviously we have to have a decrease in the COVID number of COVID cases in the region for 14 days. Each program has a dyad, if you will. So there's a physician chief and there's an administrative director who are guiding the work for the ramp up for all of their areas. So right now we are putting together all of those documents. We're pulling them together. We are going to have one document that will guide the ramp up of everything, and so that's the big work that's going on right now, as well as the other work keeping everyone safe.
Thanks again for your time today, Derek, and thanks for shedding a little bit more light about what happens behind the scenes at Niagara Health.